Coccidioides. Coccidioides is a systemic fungus which causes specific disease in the organism, which we will study, but the specific species in this genus that causes this infection will be Coccidioides immitis. Now, Coccidioides immitis is also a dimorphic fungus. Dimorphic meaning that outside the body, in the soil, it forms a specific shape, while inside the body, it forms a different shape. Now, inside the soil, it looks like a hyphae, which is septate looking, but inside the body, it forms spirules. Now, this organism, when within the soil, divides asexually. Now, the type of division that is occurring in this is that it forms anthrospores. Anthrospores meaning that the ends of the hyphae become segmented. They become fragmented, and similarly, this bud gives rise to more of its hyphae units, and similarly it divides and redivides. Now, this fragmentation type of division is known as anthrospores formation, which gives rise to further colonies. Now, this anthrospores or this hyphae is being inhaled. When it enters the body, it forms into, we know, spirules. Now, spirules consist of, it is a double layered thing which has multiple small cells which has a central nucleus. Now, what this thing does, it affects different parts of the body, but as it's inhaled, the primary area of its effect would be the lungs. Now, mostly if it is normally asymptomatic, it does not cause specific disease, but in some cases it can manifest as symptoms such as fever and cough, influenza-like symptoms. And approximately in those people, if we have 100 patients, or in 100%, approximately 50 of them have a specific chest finding, which meaning that they have infiltrates seen bilaterally, or they can have an adenopathy, which is enlargement of the lymph nodes, and they can also have in some cases effusion around the lung space, that fluid accumulates outside of this space. This is known as a pleural effusion. Now, approximately out of those, the 10% also develops a specific condition known as erythema nodosum. Now, erythema nodosum is actually not a bullseye-like. It's not a bullseye-like. It is basically erythema of the skin. Now, normally this erythema is seen on the extensor surface, such as the tibia and the ulna. And apart from that, patient also have joint pains, which is known as arthralgias. Now, when it was discovered in certain parts of the United States, the disease was called valley fever, where it was encountered first. Those people also called it Sanguine Valley disease. Now, in Arizona, this disease was also encountered with similar presentations such as arthralgia. Those people call it desert rheumatism. Now, in some people, these amount of people, in approximately 100 patients, if we test their skin by implanting some of its antigen incarnated by this fungus upon their skin, they will have an induration. Now, this induration is normally time dependent, that it indicates it is normally seen after 2 to 4 weeks. Now, this induration normally, which is seen after 2 to 4 weeks, indicates that there is delayed immunity. Now, delayed immunity is actually a good thing in your body, that it actually is making antibodies for it, that is providing immunity to you. So if we see an induration which is approximately 5 centimeters, we can clearly know that antibodies have been formed against it, and it is combating this disease. So hence we can say in approximately 100 patients, only 50% have a few lung findings, and approximately out of 10% develops erythema nodosum. So it is not very severe in immunocompetent people. But what happens in immunodeficient people? Now, immunodeficient people takes up that 1%, that unlucky 1%, which cases are that this fungus can go to the brain and cause meningitis like symptoms, and that can cause It can go to bone and cause osteomyelitis and skin nodules. Now, what happens if we do a skin test in these people? If we do a skin test in these people will have a negative skin test, because obviously antibodies can never form in them. Because why? Because they are immunocompromised. But the titer gradually raises. Okay, now how do you identify it based on labs? Now, if you take a laboratory finding, if you study the tissue specimen, obviously we know that in the tissue it converts from a mold to a yeast. Yeast is a spirule. So what will you see in the specimen? We will see spirules. Now this specimen is treated with KOH, so it can dissolve the rest of the tissue, and we can see it, this organism, because it's a fungus. Fungus are very difficult to be seen by gram stain, so we use special stains for them, which is use a methamine silver stain. Now it can also be cultured on a special medium which is known as Serology agar, and this organism is grown in the form of yeast at 25 degrees centigrades. Similarly, specific molds have a specific temperature, so it should be cultured upon those temperatures. Now, serology indicates that there is increase in IgM, which is the primary antibody, which is formed by the plasma cells upon initial antigen presentation, and then later on a lot of IgG forms, which are memory cells, which can combat against further fungal infestations. Now, this antibody appears approximately 2 to 4 weeks, hence our skin test being positive around those 2 to 4 weeks, which helps us to differentiate that the immunity has developed in that body. Now, if the patient is asymptomatic, which we know that the patient had influenza-like symptoms, and we had a positive skin test, we normally do nothing. Because it's a fungal, it will go out, the immunity will develop. You do not need to take any form of drugs in order to combat it. But in mild or disseminated disease, in which you actually have infiltrates and adenopathy and a little maybe sign of effusion, you can take the itraconazole or amphotericin B. But in severe condition, in disseminated cases where meningitis is called an immunocompromised patient, the patient need to take fluconazole, and they need to take it for a long time because their immunity is a potato. Potato meaning the patient has no immunity at all. So, and in lung diseases, we can also give the patient ketoconazole.